As a firefighter, you are at risk of repeated exposure to hazards like combustible chemicals and materials. Many of these are carcinogens that can cause cancer, so properly performing decontamination is a small but important thing you can do. You can be exposed to carcinogens through breathing, swallowing, and absorbing them through your skin before, during, and after firefighting activities. This video shows you how to properly decontaminate on scene. At the end, we'll also cover what you need to do post-decontamination. Each step is critical to lowering your risk of harm to you and your crew from contaminants that can cause occupational cancer. These steps should be performed on scene, never in your home, your car, or public places, like a laundromat. Each step is critical to lowering your risk of cancer and should always be completed in order while wearing the appropriate personal protective equipment. Advanced cleaning may be required for ensembles that are contaminated with blood or other body fluids, asbestos, or other hazardous substances. Wet decontamination procedure. Wet decontamination should be performed on scene following training or an emergency response. Starting at the top of the head, use a soft bristle brush to remove any visible contaminants from the firefighting ensemble, such as debris and dirt. Gently rinse down using low pressure and low volume flow water, not from the foam line on the apparatus. Use a brush, mild detergent, and water to wash the firefighting ensemble. Starting at the top of the head, working your way down, rinse with water. Next, take off your gloves. Wash your hands with wet wipes or soap and water. Put on nitrile gloves, following proper procedures when putting on and taking off gloves. Remove your helmet. Unbuckle your waist belt and place the cylinder from the self-contained breathing apparatus on a supported surface while remaining on air. Remove your bunker jacket. Lower the flash hood to your neck. Remove the facepiece and remove the flash hood. Wash the nitrile gloves with wet wipes or soap and water. Put used wet wipes in a garbage bin. With gloves on, clean your face, neck, ears, hair, wrists, and forearms using a fresh wet wipe or soap and water. Again, throw the wet wipes in the garbage. Next, put on, at minimum, a fit-tested N95 respirator. Perform a user seal check. Finish with the general post-decontamination procedure. Dry decontamination procedure. Perform on-scene dry decontamination only when wet decontamination is not possible due to weather or a second set of bunker gear is not available. Starting at the top of the head, use a soft bristle brush to remove any visible contaminants from the firefighting ensemble, such as debris and dirt. Remove firefighter gloves. Wash hands with wet wipes and put on nitrile gloves. Follow proper procedures when putting on and taking off gloves. Remove your helmet, bunker jacket, and lower the flash hood. Come off air and remove your facepiece and flash hood. Wash nitrile gloves with wet wipes. Put used wipes in a garbage bin. Wash your face, neck, ears, wrists, and forearms with wet wipes. Throw the wipes in the garbage. Put on at minimum a fit-tested N95 respirator and perform a user seal check. Finish with the general post-decontamination procedure. Post-decontamination procedure. Always make sure to complete post-decontamination after an on-scene wet or dry decontamination. Clean all tools and equipment according to the manufacturer's instructions before putting them back into service. This can take place on scene or at the fire station. Place your firefighter ensemble into a clear plastic bag and seal it for transport back to the fire station. Bag and seal the self-contained breathing apparatus for transportation. Remember, you should never use your own vehicle to transport contaminated gear. Upon return to the fire station, fully wash and sanitize the self-contained breathing apparatus according to the manufacturer's instructions. This should never be performed at home. Decontaminate and dry all boots, gloves, helmets, and other personal protective equipment according to NFPA 1851 and the manufacturer's instructions. This should happen in a dedicated space, never in regular laundry rooms. Remember to shower and change into clean station wear as soon as possible, and no later than 60 minutes after returning to the fire station. Washing and drying procedures. When washing personal protective equipment, put on examination gloves, an apron, and protective sleeves or coveralls, and safety glasses or goggles. If there is risk of exposure, wear a fit-tested N95 respirator. Fill a sink or container with water no warmer than 40 degrees Celsius and a mild detergent with a pH between 6.0 and 10.5. Follow the detergent's manufacturer's recommended ratio of detergent to water. Gloves. Put your firefighting gloves over the examination gloves and rub the gloves together briskly, ensuring the cleaning of all surfaces. A soft bristle brush can also be used to clean the outside of the gloves. Then, remove the firefighting gloves and refill the sink with clean water to rinse both the interior and exterior of the gloves. You can also use equipment that provides airflow to help the interior of the gloves dry faster. Helmets and face shields. Hand wash helmets using a soft bristle brush to reach between components and scrub both the exterior and interior of the helmet. Rinse helmets thoroughly and dry with a soft towel before air drying. Use a soft cloth to hand wash face shields. These too can be left to air dry. Footwear. Use a soft bristle brush to scrub the interior of footwear, followed by the exterior. Next, thoroughly rinse both the interior and exterior with clean water. If you don't have specialized drying equipment, hang the footwear upside down to dry. Be sure the runoff water does not create a slipping hazard. Follow the manufacturer's instructions on how to apply a sealant, conditioning, or polish to leather footwear after it has completely dried. By completing on-scene decontamination plus post-decontamination at the fire station, you are helping to reduce the risk of harm to you and your crew from contaminants that can cause occupational cancer. Remember to always follow these procedures in order and wear the appropriate personal protective equipment.